To facilitate cervical rotation and side bending opposite to the side of the restricted facet joint, have the patient supine and support the head with the hand on the side of the restricted rotation. With the other hand, place the medial side of your second metacarpal phalangeal joint on the edge of the facet and pillar to be manipulated, and let the rest of your hand relax on the posterior-lateral portion of the patient's neck. Move the patient's head and neck into flexion, contralateral rotation, and side bending to take up the slack until the segment to be treated is identified. Using force through the metacarpal phalangeal joint, slide or upglide the cervical facet in an anterior superior medial direction at a 45-degree angle to the spine using a graded oscillation. To facilitate rotation and side bending toward the side of restricted facet movement, support the head with the hand opposite the restriction. Position the neck in extension, ipsilateral rotation, and side bending. Move the patient's head and neck until the segment to be manipulated is identified. Using force through the metacarpal phalangeal joint of the second digit, slide or downglide the cervical facet in an inferior medial direction at a 45-degree angle to the spine.